So we'll go back to the agenda. And any apologies, Matt?
No apologies for absence, Chair.
Right. Declaration of interest. And number 2, SAMB. No, nothing. Okay, number 3 on the agenda, staffing update, scrutiny committee, pages 5 to 10. Lisa, who's taking this off?
I will do, yeah. So you asked for an information report on staffing. So obviously this is the report I'm providing. Section 3 gives you a snapshot of the past 20 months. So I've just selected some random dates and just give you a flavour about where we were at specific times around sickness and absences. Just to sort of highlight sort of later on in the report, we've now had recovery grant of 1.4 million, which we're in the process of deciding how that's going to be spent. And there's set criteria for that. So a lot of that is going to be around supporting staff, well-being, and obviously recovery from the pandemic. So one of the areas that we are prioritising is well-being of staff, because, you know, they've had one hell of a 20 months. And obviously we want to make sure that they feel that they are sort of valued. So we are looking at each team having an amount of money that they can have a team building session and have some sort of downtime and some time to recoup, I guess. But also we know that we're going to have demands in the service. So we put some additional resources into, for example, mental health services and occupational therapists, because that's 2 of the areas that is sort of we've had some increased demand. So we put some additional agency workers in there, and we've looked to put in additional agency support workers and social workers into children's services to meet some of the demands. Obviously then that fits with sort of the budget report that comes next, because obviously having that extra funding coming in to meet some of the higher demands we've had has obviously had an impact on our core budget. So I'll answer questions on that as we go into the next report. So I wasn't sure if the report I provided gives you what you wanted, but obviously if you've got any further questions, I'm happy to answer, or I can bring another report back in future.
No, it's something that I do appreciate what this report is, and to myself, it shows us how much work the staff have done over the last 18 months. You know, your report is saying because most of the female works in that division. Younger children, children had it, they went off with it, and you know, some have come back, some, but it's what they've done. I think you've done tremendous, and your staff as well, to keep this going for 18 months. And nobody knew what this virus was going to bring at the end of the day, were they? You know, nobody knew what lockdown would be. Nobody knew when the health board would be in such a state. But yeah, I support it. Good. That's my comments. Right. Any questions, members? Ian?
Yes, Chair. I was looking at paragraph 4.5, and you're talking about staff difficulties in domiciliary care, and that your capacity is being reduced, and as a result you can't accommodate people who want to come out of hospital. And I can see that this is a bit of a catch-22 situation for social services, but you also mentioned there that the Welsh Government is looking at options to improve this situation. Can you give me just an idea of what sort of thing they're looking at?
Okay, so if I give you an example then. So for example, if you get a call, so if you're on a shift today as a dom care worker, your first call in the morning might be at 7 o'clock in the morning. So you go and do a breakfast call, get somebody out of bed, you know, make them a cup of tea. The issue is that they get 15 minutes to do that call. So whereas in the past, the dom care worker would go into a family home or, you know, older person's home, and they could be there for an hour. That doesn't happen anymore, because obviously you're on a time schedule. So you get a 15-minute call, or you might get a 30-minute call. The person might have 7 calls to do that day, but they're paid for that day. So they get their wage for that day. Their last call might be 10 o'clock at night to put that person to bed. So they could be out from 7 till 10, but they only get a day's wages as if they worked 9 to 5, if you like. They don't get, you know, paid throughout that time. They might get paid for the call. The other thing is you've obviously got, if you go to the first house during the day and that person perhaps has fallen in the morning and that person gets there, they're under pressure then, or they fall behind for their next visit. So, you know, they're on a constant catch up. So what Welsh Government is looking at, and obviously this is pressure from directors and heads of service, and obviously Angela can come in if she feels I've missed anything, then what happens is, so what they're looking at is proper sort of contract of hours, so that people perhaps work shifts. So like in care homes, you work a shift and, you know, you might work 9 till 2 or 6 till 2, and then the next shift comes on 2 till 8. But a dom care worker doesn't do that. They're either working all day and they get their calls for the day. So what they're looking at is changing working arrangements for dom care workers and making it more professional, so that they've got sort of, you know, a vocation, somewhere to go. Because at the moment, if you're a dom care worker, there's no opportunities for promotion, you know, unless you become, I guess, a senior or somebody who's handing out the work. But those jobs are few and far between, because obviously we need dom care workers. So it's about making it more professional, and also sort of having a sort of changing their terms and conditions, and also the pay will be looked at. I mean, at the moment, you know, if you come to Merthyr, if you went to, I don't know, I don't think so much our neighbouring authorities, but maybe North Wales, we're paying different salaries. So it's about making it more national. So it needs to be a national approach to this, to make sure that these people are getting better terms and conditions. They're valued for what they do. And obviously that we work together. The other issue is that health sometimes employ healthcare support workers. So you will have seen during the pandemic, lots of adverts for healthcare support workers, similar qualifications, similar sort of role, but health sometimes pay more than us. So you could be doing similar work, know that you're going to travel around because you're in a hospital setting, but get paid more. So we are robbing Peter to pay Paul often. So it's about working sort of, we're going to work with our health colleagues as well to have a robust plan. So it's not a case of, you know, health and social care. We've got to do this together.
Yeah, that's very good news. Thank you, Lisa. I'll just ask you one little thing. When you talk about 15-minute calls and 30-minute calls, I take it you don't include travelling in that, do you? In between calls?
No, I don't think travelling is included in that. But I mean, presumably, most people, they would try and, if they divvying out, you know, work, they would try and do it in similar areas. I mean, Angela's nodding, so perhaps time, you know, travelling is included.
Yeah, okay. Thank you very much.
Is allocated, but also allocated travel time between calls, and they paid for that travel time. And the calls could be anything from 15 minutes to an hour and a half. So it's dependent on the needs of the individual rather than the capped specified time.
Right, thank you, Angela. Thank you, Chair. That's it for me.
Gareth?
Thank you, Chair. It's a follow-on from Ian's, really. I appreciate the report is about staffing, Lisa, but on hard figures, how many roughly, say, at the moment are waiting to be discharged from hospital? How many residents?
I think the figure we had last week was there were 45 that health were expecting to be discharged from hospital. That doesn't necessarily fit with our figures, because obviously not all those 45 would be referred to us.
Yeah.
So I think at the moment we're working on a list of about 16, am I right, Ange?
In total, we've probably got around 45 at this moment in time. That's a mixture of people waiting for care homes, but they're not all ready to move into the care home. So they could be at different stages. They could be waiting for the nursing assessment. They could be having further OT assessment to contribute to this, the overall position to provide the care home, to make sure they go into the care home and meet their needs. And that there's around 15 people waiting for packages of care, but they are moving. For example, 7 were discharged last week, and I think we need to get over that they're not the same cohort of people. So there are people moving through the system. However, we seem to be staying at the same number, even though some are being discharged, new ones coming in. And what we are seeing is increased complexity of needs of those individuals.
Thank you, Angela. Thank you, Lisa. Bill, I got a couple more, is that all right?
Carry on, Garth.
Yeah. First of all, I wanted to just thank you for the report. It's very, very comprehensive, Lisa and colleagues. Throughout the details of absentees, is roughly about 10%, I think you say, is absent on average. How does that compare pre-pandemic? Perhaps it's in there, I missed it if it is, sorry.
I don't think it is in there, Councillor Richards. I think
Go on. God will have to come back when Lisa come back.
No system.
She's gone, she left us.
No, sorry,
Oh,
my daughter knocked the door at the same time the dog started barking. Got to think now where we were. I think it's probably a slight increase with regards to absence, although our absence I think is usually between about 4 and 8% at any one time. But I mean, a lot of the absence this time was because of people isolating. There were people off with other reasons, and some obviously were off longer term from previous issues before March. Generally, sort of, you did see an increase. There was some months we had like sort of 17 to 20% absence, but that seemed to fit with the peaks that we were having in Merthyr at the time, where in the community that absences and sort of the COVID was very high. But generally it was around about 10% throughout.
Yeah. And obviously you've given the figures for COVID, Lisa. It's quite possible that some of the others were off, or would you know if they were off, around the stress of the, obviously the extra pressure of work as a result of COVID?
Yeah, I mean, I didn't have that information to hand, but anecdotally, I would suggest that some of them were off because of stress related. Certainly, as we've got more, more recently, because people are sort of quite stressed at the moment, and they're sort of feeling exhausted by everything that's been going on.
Yeah, right. And my final one is being a bit pedantic. In paragraph 4.2, I think it should be October rather than November, but just for the minutes, for the record. The last 2 weeks of October 21. In 4.2.
No, what I meant was the previous 2 weeks of November.
Ah, right, yeah.
Yeah, so it was November. It sounds like I meant the last 2 weeks, i.e. now and next week, yes. But I meant the previous.
My apologies. Yeah. And thanks again for the report. I've no further questions, Chair.
Thank you, God. Any questions, else? What support can we give to the domiciliary workers, because they're working like a split shift? I used to work split shift myself when I used to work on the buses type of thing. And it's not good enough for nothing. It's mental health problems, they've got family problems. So what help can we support them and see if they can have a full package, a full pay for the day, and not work 10 hours and get paid 8 or 6?
I think at the moment all we can do is contribute to the work that's going on in Welsh Government and what we're doing regionally. So always trying to improve their terms and conditions, but also looking at sort of what they're paid. I know that ours have had an uplift in respect of sort of real living wage in the last, probably before the pandemic, but even during the pandemic, and obviously that's something that we can look at as part of the recovery fund. But some local authorities obviously increased payments. I think ours are probably paid reasonably well, on par with health. So that's what we need to look at, is making sure they feel valued and making sure that we're providing them the appropriate training and making sure that they've got that, sort of career progression where they can, and giving them other opportunities.
Yeah, I think we need that to take that forward. Sherelle?
Thank you. Thanks for the report, Lisa. It's really informative, and it certainly gives us a picture of the complexities of staffing issues within the service area. It was just a suggestion, really, moving forward, to look at how we can best support this, and it's bringing in a lot of what the councillors were saying in terms of how it links with the work that Welsh Government are doing in the future, etc. I was just thinking whether or not it would be useful to see some sort of recruitment or staff vacancy action plan to take us up to the end of up to the end of 2023, because there's loads in here around lots of maternity covers and things like that as well. There's lots of sickness. We've had the questions of what's COVID related, what's not COVID related. And I think, you know, our biggest asset is our staff and our workforce. So what I would like to see is the plan of how we're going to tackle that moving forward up to the end of, say, 2023, making sure that it's all encompassing around the things that you've mentioned. Like, you know, it's great to see that we're giving something back to the team and leaving them have a team building day or event or whatever you said it was. But just to make sure that we follow that through then. And I was just thinking about things like, you know, allocated time for face-to-face supervisions to remain important, to look after people's health and well-being, the use of the social care recovery grants to make sure we've got that capacity within the service moving forward, training, workforce and development, continuing with the work that you've said you've started doing about, you know, the importance of staff questionnaires to really gauge where they are, where they think the pressures are, what they think is really good within their teams and what could be improved. And I just think that, you know, it'll help us to develop and maintain a stronger workforce, because this is such a critical area for us, for the local authority. And it could even include things like exit interviews to know that if people are going, why are they going? And for that to be fed back to Scrutiny so we can understand what the real problems are within the workforce. But it's just a recommendation to go forward with.
Thank you, Councillor Jacob. We'll certainly take all those on board. The question is, we are still doing within the service. We are better at the exit interviews now, so that is being fed into, you know, feeding back as to why people are leaving. I have to say, fingers crossed, and perhaps I shouldn't say it out loud, we are being quite successful at recruiting at the minute, probably to the detriment of our neighbours, because we're having some people move across from, you know, neighbouring authorities. So, you know, we are filling really important posts now, so that's positive for us at the minute.
Yeah, and that's what it's all about for me, is seeing that in some sort of plan, so we can see, you know, what's green, what's a bit amber, and what's red, so we can support you in making sure that you've got the appropriate support to move forward with your service area as well. Thank you.
All right, Sharon. Yeah, right. Jack, you were doing that. All right.
Bill, a lot of it has been answered, but just quickly, it was obviously Sherelle's just mentioned it, and it's mentioned in the report that our staff are our biggest asset within the last 20 months. They've stepped up and gone above and beyond what is expected of them, and that was 2.4. When you go down to 4.3, then it says we're in receipt of recovery grant money, and one of the conditions for the grant is to support staff well-being. Now, I know this has come up in a previous scrutiny, and it was, I think, where we are now as well, but we don't seem to have done it. Can you tell me when you're looking at doing something for staff well-being, and what exactly have you got in mind?
Okay, so that work has already started. So some of that is around what I talked about, the team building sessions and people having their opportunity to sort of, you know, build that relationship back up with their team, because obviously some of them have been quite isolated over the last couple of months with regards to home working and, you know, half the team in, half out. So we've given people time out and have that chance to sort of, you know, have sort of step back from day-to-day working, with obviously safe cover and things. The other thing we've sort of invested in is training. Specifically around sort of counselling, mental health support. So that's something that we worked with HR on, and they've come up with some ideas around that. Also sort of looking at counselling through our occupational health colleagues, and putting extra support in there to make sure that staff know that they've got that additional support and counselling if they need it. The other thing is obviously looking at the care homes and how we can support those. So we're looking at sort of, areas to improve the gardens within our care homes. You'll be aware that our learning disability home Lisbane moved into the empty wing at Tigurnos during the last couple of months, which was slightly delayed because of the pandemic. But we're also going to invest so that staff can start a sort of a garden for them up at Tigurnos, and be involved then in sort of growing their own vegetables and things like that if they want to, and generally around that staff well-being, and obviously our service user well-being as well. So they are some of the things we're sort of thinking about over the next couple of months. The recovery grant has got to be spent by the end of the year. So obviously that piece of work is happening now.
Lovely, thank you, Lisa. Just one more thing then, sorry, Chair. In 4.4, you're looking at included in the plan is for the recovery grant spend is additional resources within agency staff, and it just goes through that. And it says, however, this will be dependent on the availability of agency staff, which are in high demand. Now, being a school governor, I know how difficult it is for them to get staff. There's just no staff out there. Can you tell us a little bit about how the pressures that you're facing? Is there a big shortage?
There is a real national shortage, of social workers. We've been lucky enough to recruit some agency support workers. So those that we had early on in the pandemic. So we've always had agency workers, whether it be 1 or 2 in the service, whether it's because of maternity cover or vacancies. We needed, the full capacity. So what we've done is we've extended those contracts. So we've got some agency workers that probably their contract should have ended by now, but we've extended their contracts to remain with us because they're already here, and obviously that continued. One of the issues with agency staff that we have come up against more recently for new ones is because they've been working online for so long, and people want agency workers so they can have their own terms and conditions if they want. Then we've struggled to get agency workers, if we needed new ones, to come in face to face and do meetings. We'd get them to do sort of online and virtual visits, but we need them to come in, and they obviously can pick and choose the local authority they want to work with. So that's been a sort of a struggle for us, and we just keep trying, and if need be we go off the framework, and obviously go outside of our procurement contract and use other agencies if need be, obviously with the most appropriate checks like DBS and everything else and references.
Right, thank you, Lisa. Just on that, then, with the difficulties in finding the staff, it's not putting the service you provide, it's not putting people at risk, is it?
No, I would say we've managed to cover what we need to cover, and obviously we prioritise things. So if it's high level needs, or whether it's high level child protection or adult protection, then that's what's prioritised. Obviously we brought support workers in to bolster the team, but they carry appropriate caseloads, and they obviously do visits to appropriate families, older people where it's appropriate, and obviously make sure they're seen and keeping in touch with people. So we are offering appropriate support to the people who need it.
Lovely, thank you very much, Lisa. Thank you, Chair.
Okay, we did have the hand up for the youth member, independent member. Khan, are you here?
Yes, thank you, Chair. With the recent announcement in England that they're going to have mandatory vaccinations for social care staff, what's the vaccine uptake amidst the staff in Merthyr Council?
Okay, thank you, Kia. I haven't got the actual figures. I can find out that for you. We've had a really good uptake. So I would say that it's probably 90+% for our staff. As soon as the vacancies were on offer, then staff were willing to go ahead. I could probably count on one hand names of those who I know haven't had it. Some of those are because of health reasons. We had several, or 1 or 2 turn it down because they were pregnant. And obviously at that time there wasn't much information about people being pregnant having the vaccine, but now they've had their babies, they've all had their vaccinations. But generally people have been very good and they've signed up and had the booster as well. Care homes, obviously the staff there were sort of an audience that they could get to, because obviously the vaccines were taken to them, so that was much easier. But we've had very, very few people turning them down. We've had one or two sort of having some anxiety about the booster because they may have been felt poorly after the second injection, you know, flu-like symptoms and sore arms. But generally, it's been a really good uptake.
Okay.
Thank you.
Any other comments from members? Everybody happy with the report? This is the report, but can we have the comments that Sherelle made? So we that will come back to us.
Yeah,
So
no
at
problem.
least we got that's an action plan to find out about this, to support it with the staffing.
Yeah, no problem.
Okay, so we're on item 4, budget update for scrutiny committee.
Okay, you'll be bored of my voice this afternoon when you use my report again. Okay, so this report gives you an update on the budget position at month 5. So I know we're in November now, but it's for the end of September because the other hasn't been published yet. Section 4 outlines where we were. So it shows at the end of 2021 that social services were in a positive position. The underspend, though, was probably due to the hardship funds and the grants that we'd had. Oh, somebody's just flashing the screen. And so that obviously was, we were putting that against some of the high demand areas, which has probably masked some of the spend in those areas. We previously, as you know, invested in the Support and Change team, which we've started to show some really positive signs now because our looked after children figures have started to reduce. So we're seeing the dividends now of that investment before the pandemic. Section 5, where we are now, outlines the budget as it is at month 5. So you'll see the table there with all the detail. And table 2 then highlights the variances in the budget. So some of the underspends and the overspends, which I can explain if you've got any specific questions about them. Section 6 talks about where we want to be. So clearly we want to be sustainable moving forward. And obviously that links to the improvement plan and recovery, which is the next report. And then what we need to do next, well, obviously we need to continue to meet regularly with the finance officers, which we do sort of on a monthly basis and have those regular discussions, more so of late because of the amount of grants that we've had into the department and the timeline of how we have to spend. And obviously our cabinet member is part of that meeting. We obviously attend budget boards and we're challenged in those sessions for any variances within the budget lines. We'll continue to work regionally, which moving forward is really important because obviously there's now a 5-year funding plan moving forward from 22-23. We haven't had the detail and the guidance for that yet, but we've got obviously starting to think about how we would spend any new monies coming in and what we need to do to innovate in our services. And then we also need to plan for the significant pressures that we know we're going to get. So I've highlighted those in the report 7.4, but we've already covered one of the areas. So for example, Dom Care, if their terms and conditions change and their salary changes, that's going to have a major impact on our budget. And we're probably not talking pounds, you know, so we're talking probably, you know, millions. And that will be, you know, hopefully funded by Welsh Government. But if not, and we've got to find the monies, then that will have a huge impact on our current budget. So happy to answer any questions that people may have.
Any questions? Least on the then this exit grants. Are we looking for next year? Are we going to have the same hardship funds and bits and pieces put in place, or are they going to be acts? Because if I
we have been advised that the grants are for this year only. So the recovery grant has got to be used and spent by the end of March 22. So there was a really clear set criteria and what we could spend it on before then. So obviously that is obviously in planning now. We've obviously drawn up an area of what we want to spend it on, and obviously we've got to spend it by then. The hardship fund already had started to be tapered off from September, October this year. So some of that is not being given out to care homes now, because obviously they're the ones that probably have benefited from that the most. Probably the wrong word, but you know, they've been sort of helped more so. And that's being tapered off now until the end of March. So that's unlikely to move forward. one of the things that is going on at the moment is there are regular discussions with the ministers. So there was a ministerial meeting about a fortnight ago where I think Councillor Morgan from RCT and Councillor Hugh David from Bridgend, who were the WLGA and the leads there, involved, and discussions about our future funding. And obviously the feeling is that we are going to have the tsunami of cases. We've already started to see the rise in children's mental health concerns, and adult, concerns where they're more vulnerable. Long COVID, we don't know what implication that's going to have on us. We're already starting to see people sort of, not backlog, but they're in the hospital, so there's an issue with flow because we can't provide packaged care. So, we're starting to see that demand now. So they are starting to prep for what future planning and funding is going to look like. And I think it's very clear we can't have a year-on-year budget. We need to have, it's going to be a 3-year plan or a 5-year plan, so we know where we are, so we can start planning for services. And that's certainly the ICF funding we're having for next year has been given us on I believe, a 3 to 5 year plan. So that'll be better next year rather than it be year-on-year and we don't know, what we can provide longer term. That would be better for us in Merthyr, because sometimes we are in a difficult position because we can't offer longer term contracts, because if the funding's only given us for a year, then we can only offer a year's contract. Whereas if we have longer term funding, we can provide permanent posts and we are more likely to recruit then. So that will have a huge impact on us.
Thank you, Lisa. I support on a 3 or 5 year plan, because you know where we're going. We could put things in place and take it forward and look after the service, because I can see if this cutback's happening, the service will go. Some of the service won't be there, and we're back in square one.
Yeah, I think it's more about us being innovative now and being sustainable. So it's looking at what services have had changes in them because of COVID and what we need moving forward, because people's needs are changing. They don't necessarily want to go to a day service. They want perhaps somebody to provide the service in their home. So, we might have to provide more personal assistance and, things like that. So, we need to look at what service is going to look like in the future.
In other words, we're going to review all services to make sure it works. Okay, any more questions? Are we happy? Ian?
Thank you, Chair. Well, the budget seems to be holding together very well. So, Lisa, well done for that. So far, so good. One thing I wanted to ask is on item 4.5, you talk about the Tackling Poverty group that's been set up. I think poverty is one of the actual major issues for the people of Merthyr at this point in time. And I'd like to see some sort of report, like either from the group or from the council as a whole, as to the overall picture on tackling poverty. Is it being scientifically examined? Are you looking at absolute poverty, relative poverty, both? Or, how does the council view it, and what's the sort of overall strategy? Will there be any sort of report coming from anywhere on that?
Okay, so one of the things we're doing at the moment, unfortunately, some of the tackling poverty meetings have been delayed over the last couple of months because of the pandemic and sort of, other things taking priority. What we sort of decided or discussed is to have a poverty summit, for want of a better phrase. So there was going to be a meeting with Cabinet, and Councillor Jago, as our poverty lead, was invited as well, to go through where we're at, to look at the data across all the poverty services, or all the services that deal with poverty, to bring that data together, to look at future service and how that looks, and to look at it in the context of prevention. The other thing to be aware of is that we've been working with Lloyds, and one of their remits is to look at poverty in the area, Lloyds Bank, and to bring that together with the third sector about all the areas we're working with. to look at what prospective funding we'll have in the future, but also to look around mental health needs as well. So that is in train, and that is what we're looking at, and I'd be happy to bring a report to you in future once we've had that summit.
Yeah, thank you, Lisa. Thank you very much.
What's the time scale on that then?
The summit should have taken place last month, but unfortunately one of the key officers was on sick leave. So I know Heidi's trying to find us a date now. I would have thought realistically, unless she can get us all together for Christmas, it's likely to be January. So it probably wouldn't be ready for the next scrutiny, but maybe the next one after that.
Okay. Are you happy?
Yeah.
Thank you, Bill. Welsh government come up to give £100 out to families that's struggling and something like that. So what I only heard a bit of it. What's the input in that then?
I believe it's basically a £100 grant that families can claim. I think there's a set criteria. There has to be certain income and whether they're already on benefits. And I believe they make a claim through local authority, but I don't know any more detail than what I heard myself on the news.
So can we find out a bit more information on that and somebody send an email on it?
Yeah, I can certainly find. I would have thought it would have gone into Economic Regen Department because I think they dealt with the grants last time, but I'll certainly find out. I'll raise it at CMT.
Because of the part of social services and we talked about it, so I'd like to know a bit more. Are we happy with that at the moment? Okay. So we're going item 5, and the social services recovery, transformation and improvement plan update. At least now we'll have a sore throat.
I know. I won't be singing tonight. I'm going to Greece after.
Oh, I usually sing before now. Behave yourself.
Okay, so the Recovery and Transformation Improvement Grant. Obviously, there's background to the report. This report has been before on several occasions, so this is just the update as to where we're at in the recovery at the moment. 6 outlines where we are now, so it looks at the highlights of each of the projects, and several of those projects have now been completed. So obviously officers can answer questions on those. The key is obviously the recovery grant allocated us from Welsh Government. It's going to have huge impact on what we're going to do and as part of the recovery and transformation. So at 6.4 of the report highlights some of the areas that we're supporting. So that might have been not been clear in the last report around budgets, but that sort of highlights what we're looking to spend that 1.5 million on. There's really sort of tight set criteria for the recovery grant, and that obviously aims around well-being of staff as well. So we're very keen to sort of ensure they're provided with support, because obviously they are the key to us recovering from the pandemic, because we have to have the staff and take them forward with us. So I think we're probably in a really good position. The improvement board is obviously still working with that, and we've got Tony Garthwaite as our lead. We've got a meeting with him and Steve Thomas, who's the chair of the board, in January to go through our SWOT analysis. So obviously to look at our strengths and weaknesses, and then obviously they will feed back to us as to where they feel we compare to when they first came in, you know, pre-pandemic. I think considering what we've been through over the last 20 months, we've made some fantastic strides ahead. And we've filled the vacancies we need to do as part of the capacity exercise. So we are definitely in a better position, albeit that we're all absolutely shattered over the last 20 months. But we're in a really good position at the minute.
Yeah, any comments, Lisa? I wanted to say, I've said it before, you and your staff and your team have done marvellous, to be honest. So the last 20 months, it's been ongoing, and nobody knew what, from 18 months ago, what this virus will bring, because it brought misery. Nobody knew about lockdown. I think everyone learned a different ballgame in the last 18 months. So I support everything you've done and your staff. It's doing off you can say that you're excellent. Any comments, anybody? Yeah, sorry, missed you. Yeah, sure. Sorry.
How can you miss me? No, thanks, Chair. At least just to echo that, really, and you know, it is volatile managing such a big budget for social services, and it's been, you know, financially, it's been a good year with the support of the recovery grants of COVID coming through, and I just really hope that Welsh Government recognise this and recognise that, you know, we're only scratching the surface of the work that we need to do for a pandemic recovery period. And I really do hope that that investment follows through next year, so you can continue to grow the service to provide the best support that's required for our constituents. So hopefully that message will come through from Welsh Government and the money will follow. Fingers crossed.
Yeah, I agree.
Okay, are we happy with that? Right, and we go back on to Children's Services, item 6. I think it's a change of voice, the same as Sarah.
Right, Taryn is on her way back, so she will log on as soon as she gets back into her house because she's up to attend an appointment. But Tracy's going to go through the report with you until she comes.
Welcome, Trace. Start again, you're on mute.
That's always a good start, isn't it? Sorry,
Yeah.
Thank you very much.
Sorry,
yes. So I'm not sure what you want from me, or whether I wait for you to ask me the questions.
Oh, just if we go to the report, just the basic report, and we'll jump in as we go along.
All right, okay. So if I could start with the key issues, the introduction and background speaks for itself in regards to where we've been, and the implementation of some of our services, including the early intervention group, which is right help at the right time, supporting change, success, stability and transition, strategy for improving performance, workforce strategy, and the strategy for sustainable children's services. So those are the key areas that we are working towards under the legislation of the Wellbeing and Future Generations Act 2015, and the 5 areas that covers: long-term preventative involvement, collaboration and integration. And that's really supported or underpinned by the Social Services and Wellbeing Act, and the focus of the Act is on what matters to the person, how they can use their own strengths and resources to do the things which is determined by an assessment that involves the person and the professionals. I think that we all work with the knowledge of the Act and promoting independence and resilience, and I think that is one of the key issues that is being brought to the fore for children's services via the Early Help Hub, and the preventative services, and then working through each of the teams and the resources that are available to each of the teams. I think in point 4, it tells you where we were up to February 2021, and that report was shared with the Scrutiny Committee, and went through all the items that are there. Unless somebody wants me to go through those, I think that you are all aware of them. So if I move down to where we are now, I think that the report primarily explores success, stability and transition action plan. However, the importance of understanding that all the action plans that sit under children's services strategy feed into that, and that they dovetail quite nicely, really, to ensure that we are meeting the needs of our community in a way that builds resilience and allows as much interaction and engagement from our service users as is safe and appropriate. So there is, over the course of 2021, the Corporate Parenting Board has developed the new highlight structure, and this ensures that all key agencies are providing updates and overviews of how of how they adhere to the corporate parenting duties. And I think that that's really vital, because the importance of ensuring that everybody understands that corporate parenting responsibilities go across the board, can't be underplayed, and actually the success of any of our plans and strategies is underpinned by that collaborative working, co-production and involvement, and much of that is around our care leavers strategies and how that looks for our care leavers, and ensuring that any child that comes into the looked after system is offered the care that we would expect to be provided by any good parent, and that those opportunities for success throughout their lives is developed in whatever setting they may be in. And I think that's quite key. As you can see, there's been a reduction in our children looked after numbers, and that has been through the assessment process and understanding what is best for our children, looking at revocation of orders where they are no longer required to keep a young person safe, and that there have been targeted pieces of work to support families where children are residing at home, so that we understand that whether the order that is in place can be taken away, and if this is the case, then it's done in a timely way. I think the local authority has a placement and commissioning strategy in place, and that's under review currently, and that will be done between December and March 2022. And I think all of these, the strategies are important to ensure that they are evaluated and making sure that they're hitting the targets that they were put in place to do. In April 2021, Foster Wales was the regional fostering front door was joined by Bridgend, and that comes under the umbrella of the Cwmtaff Morgannog umbrella, and Foster Wales, which is now our brand, was officially launched in July and followed up with the official opening at the Senedd on the 4th of October. The Foster Wales consists of all 22 local authority fostering services, and we work in a collaborative way, and the concept of Foster Wales is speaking with one voice, making sure that making local authorities stronger in their recruitment, and I think that it's fair to say, that the local authority, all local authorities struggle to recruit foster carers, but with the incentives that have been put in place by Merthyr, the recruitment has begun to show significant benefits, really, with last financial year 3 newly approved foster carers, And that was an increase on previous years, but I think with the continued marketing and promotion that is done through Foster Wales, and the incentives that have been agreed through the council, there has been a significant increase in our recruitment this year, and 133% sounds huge, and it is. You know, that's 7 carers through the that are currently going through the process of becoming full-time foster carers for Merthyr and within the Merthyr locality. And for our children, that will be significant in regards to sufficiency and the ability to potentially place more children in the locality in which they are comfortable and which everything actually, you know, it runs from. So that's where we're at 5.6 when Taryn pinged and let us all know she's here. Do you want to pick it up, Tar?
Tracy, can I say thank you very much? Appreciate all the work you've done. And now we're going over to the boss.
Now we are going over to the boss. Sorry, it was a bit jumbled at the beginning,
No,
folks.
no
I hope
problem.
it made sense.
No problem. Cara, welcome.
Oh, apologies for being late at a prior appointment. So,
No
Trace, just to confirm, you were leaving at you were at point 5.6, is that correct?
5.6, yeah, where we were just saying about the significant increase and the real positive impact that the increased recruitment of foster carers for our youngsters in Merthyr.
Thank you very much, Tracy, for taking Scrutiny through the report to that point. So just to carry on then, so it had been anticipated that the multi-agency permanency support service was going to start their work in April 2021. However, unfortunately, due to some commissioning and barriers that needed to be overcome, that will now commence in January 2022. So we have appointed somebody to deliver on that service. That's going to be a very exciting opportunity actually for us as a local authority, and that will provide therapeutic support to our children who are looked after, to children who have been adopted, and to children who are the subject of special guardianship order arrangements. We've also continued this year to work very closely with housing, and the Neighbourhood Learning Centre is being developed for transitional accommodation for young people, and it's hoped that that will progress and there will be some construction work starting on that within this financial year. We've also secured funding from the Welsh Government to undertake a feasibility study to look at a residential care provision within Merthyr Tydfil for our young people so that they can live closer to home, and that means that we can support them in a far more coherent way due to the level of contact we'll be able to maintain. Our care experience young people have been supported and continue to support our insight into what good care and accommodation looks for them. And in terms of the Neighbourhood Learning Centre, they were really fundamental in some of the floor design of that and actually how they would like those flats set out. We're in the middle of updating and developing a participation plan for how we continue to move forward to ensure that their views are at the heart of how we develop our service. On an annual basis, end of key stage data for our children looked after is assessed and reported internally to provide intelligence on trends, and this is shared with the Corporate Safeguarding Board for further scrutiny consideration and to see how best we move forward to develop our children looked after as learners. Personal education plans for children looked after continue to be quality assured by the Looked After Children's Education Team Manager and our independent reviewing officers. Young people leaving care have every opportunity to positively fulfil their ambitions and reach their personal goals is key to this action plan, and our pathway to work has been really fundamental to that. The programme is currently engaging 44 young people. 16 of these young people have gained employment, 7 are in college, 1 is accessing higher education, and 6 accessing bespoke training for a specific area of work moving forward. What I would say in terms of our pathway to work, we are very much in phase 1, and we've already identified ways in which we can expand and build on our learning from that. However, I do feel that it's been very successful to date, especially when you consider that within the context of COVID. Moving on then to section 7, in terms of next steps for us underneath this action plan within our strategy. In 21-22, we will provide our first local authority annual corporate parenting report, which obviously will be shared with Scrutiny and then subsequently with Cabinet. We will build upon our learning from the first phase of our pathway to work, as I've mentioned. We'll continue to work with housing to look at how we support placement sufficiency for transitional arrangements for our young people. We will engage and support the development of the MAPS provision that we just discussed for our children looked after. We'll continue to ensure we co-produce our services with young people and that we promote smooth transitions into adulthood, offering our young people the same opportunities it would be reasonable for any young people to expect. We will build upon our successes of enhancing the range of housing options available to our young people so that they have somewhere safe to live. We will look to reduce the level of social isolation that many of our care experienced young people face. I suppose between myself and Tracy, that's an overall summary of the report. Apology if it's a little bit disjointed with both of us presenting. Thanks very much.
Tara, thank you very much. Appreciate it. Excellent. Can I say as a chair, since we brought this change in, is it 12 months? Or just over? Right? What a massive difference. To be honest, I can speak up because the way you're interlinking the departments, the way you're linking other organisations and supporting the children's services, I think you've done a marvellous job. That's off myself. Ian, you got your hand up?
Yeah, thank you, Chair. Just a couple of comments. Tracy and Taryn, thank you very much for going through the report. With reports, I always think that a statistic is worth 1,000 words. And some of the figures in here I was quite impressed with. For example, 5.3, targeted intervention has achieved a 39% reduction in placement with parent cases. I mean, that's quite a huge figure, and I was very pleased to see that. And the other one, on 5.12, young people leaving care. Out of 44 young people who left care, you've achieved 33 positive outcomes. Again, that's over 70%. That's a very good figure. So that's what I'd like to see in the report, and it was there. And thank you very much.
Ian, all right?
That's all. Thanks, Chair.
Any other comments from the members? Because, to be honest, this report is excellent, looking after how we're going to take this children's services into the next year or the next couple of years down the line to improve. They've got a quality of life, good education, and good care. Okay, Sherelle, I see you on. I have missed you. I think you're a bit slow on the button then.
Sorry, I'm getting slow now. Thanks for that. Yeah, really comprehensive report, and we can see, there's a huge amount of work that's going on. In 7.2, it alludes to what's next, and I'm really excited to when we receive the first corporate parent report. So that will be really nice to see. And there's evidence there that there's a huge amount of work that's going on, and the focus is really right moving forward in terms of pathways to employment, independent living, reducing levels of isolation, mental health for care leavers, etc. So when I looked at the report last week, I was thinking, okay, so are we covering everything that we need to be covering for this service area? And this might be something that you've already started work on, or you do, but maybe it's just not in that what next part. But I was thinking about so supporting people within our care leaver system, that become parents. So they become parents when they're in our care leaver system already. So, you know, I think that's definitely an area that we need to make sure that we've got a clear vision on for Merthyr, particularly, you know, when we look at the birth rates and look at, you know, the possibility of care leavers then becoming pregnant themselves and having families young. I did do a little bit of research across other local authority areas, and there seems to be a really good, let me pull it up. There seems to be a really good best practice charter called Supporting Parents in and Leaving Care. And that charter was developed with Cardiff University and NIAS Cymru in partnership with Cascade. And basically, the best practice charter is available for local authorities to sign up to. And what's included in that is some really, really good tips and you know, definitely a direction that I think that we should be going in, if not already, within our County Borough of Merthyr. So the charter was developed with care experienced parents and professionals who work with charities and local authorities across Wales. And it sets out what we could do as a local authority to help individuals plan for being a parent, how we would support them when they become parents, and what the challenges and stigma and disadvantages that they will face being in the care as a care leaver themselves. And I thought that was really quite powerful, and it gives a really clear direction of how we can best support you know, some of our constituents who are still some of our most vulnerable. So it was just a suggestion for you to consider moving forward.
And I think that's a really important suggestion, Councillor Jago. So thanks for sharing that with us, just to give some feedback on that point. So we have developed a pre-birth model within our supporting change team, and a specific arm of that looks at how we support our children who are currently looked after and care experienced. Additionally, I've been really fortunate to be part of the working group for the next stage of born into care, and that gives us some really clear guidance and advice, and actually was a really emotive, powerful working group to be part of, to hear the experience of some parents who were being care experienced, and actually how they felt that they could have been more supported earlier on. So that'll be really fundamental for us in our next stages of how we look at that. Equally, we're currently working with the health board and are in some discussions with Flying Start about how we develop a preconception model. So that's something that we will be very much looking at in the next financial year. We just really wanted to embed our current pre-birth model, so we had a really solid foundation on which to build on, but all of which are definitely on the agenda for 2022-2023.
Excellent. That's really good news. And you know, it's about not reinventing the wheel as well, isn't it? So if there's a best practice charter that's been endorsed, yeah, take a look at it and see if we can incorporate that into our models of work, and that would be fab. Thank you.
Yeah, thank you very much for that. Appreciate it. Because more information we have and what we're doing outside the county borough to support what we're trying to do. No, as I say, we've done it into his work together. No other comments? Everybody happy? Yeah, great. Thank you very much. So we'll go back to item 7 now. That's the forward work programme. Can I thank all the officers? Thank you very much. Appreciate it. Like the forward work programme in front of us. Everybody happy with that? Anything you want to put on there? No?
No.
Carl's right?
Yes, Bill, thanks.
Right. So that's been done. Then we got item 8, scrutiny referrals, feedback. I haven't got any, nobody come on to me about it. So I said, and reaction, evaluation of the meeting. As myself, over the last 18 months, 2 years, and we've gone through a lot of reports, a lot of change in the department. They all come up with different ideas, and I think today is proving a point. That is, it is working. We've got to work smarter, better, and the officers got to do the same, and I think they are showing it. young blood, as I say, and it's good. It's nice to see it coming through. So that's why I think it's very good. At the present moment, what they're doing is very, very good. And I think we're going to take it forward, and we've got good officers and good staff. So that's my comments. Anybody else on it? Okay, that's it. And if no other business of me, can I say thank you very much for your time, and I appreciate it. I'll see you next time round. Bye.
Thank you,
Lovely,
Chair.
thanks.
Thanks, Bill.
See you
Bye now.
again. Thank you. Good night, all.
Good night.
Bye.